Alright, so today we're going to be reviewing reflux esophagitis, or in other words, heartburn. Many people think that reflux esophagitis is a disorder of secretion, but in reality it's a disorder of motility because of the esophageal or esophagus sphincter. We'll get more into that in a second. Normally, your esophagus sphincter will stay contracted around the esophagus and around where the esophagus and the stomach meet, right here. But when you have reflux esophagitis, your sphincter does not stay closed as it should. So basically, the sphincter stays open and the acid from the stomach goes up into the esophagus. Obviously, esophagitis means inflammation of the esophagus, and that is caused by the acid that goes up into the esophagus. And when that happens, what you feel is that heartburn feeling and the pain, burning pain in your chest. So, obviously, this increases when, or the feeling gets worse when you eat certain foods or take certain drugs, or when you're laying down. So this usually is caused by a loss in the sphincter tone. When that happens, it's not as tight as it usually would be. So it stays open more than it needs to. And so when that happens, the esophagus becomes or gets a lesion in it. And after the lesion heals, obviously you're going to have a scar. But if you have reflux esophagitis, it's not going to stop after the first time, so it's going to happen more than once. And what's going to happen after you have your scarring and after it heals, if it's recurrent, one of two things can happen. It can come back into the scarring and it can go back around the cycle, or it can go into what's called Barrett's esophagitis, and we'll get to that a little bit later. So for when the acid goes up into the esophagitis, your reflux that you're feeling, you're going to have some symptoms. Like I talked about earlier, you're going to have that heartburn feeling, but you're also going to have some dysphagia, which is trouble swallowing, and you might even have hemorrhage. And so back to this cycle, when you have recurrent acid getting into your esophagus over and over again, you're going to have this additional scarring over and over, and that can lead to what is called Barrett's esophagus. And what Barrett's is when the squamous cells in the esophagus turn into columnar cells. So, as you can see here, a normal esophagus, there's no scarring in the tissue at all. You just have a normal esophagus. But after the esophagitis comes and comes and comes, you're going to develop Barrett's esophagus. And that's this discolored lining and the scarring of the tissue. And what Barrett's esophagus does to you is that it increases your risk for, well, it's a risk factor for adenocarcinoma. Alright, so to recap, we know that reflux esophagitis is a motility disorder that affects the esophagus sphincter. It makes the sphincter relax more than it should, and that allows the acid to come up from the stomach and go into the esophagus. When you have your reflux esophagitis chronically, you develop Barrett's esophagitis, which is in turn a risk factor for adenocarcinoma. Thank you.